progress we made by flattening that curve, we could lose that in a matter of days if we're not careful. And it's important that people understand what that actually means. And this gets a little technical, but it's worth understanding. If I can understand it, anybody can understand it. They talk about the rate of increase of the spread of the infection, right? The R0 factor. But it's basically straightforward. If one person infects less than one person, that's the first category of R0. One person infects less than one person. The next step up is one person infects one person who then infects another person, 1 to 1 to 1 to 1 to 1. The worst situation is one person infects 2 people, and then those 2 people go out and infect 2 people. And that's fire through dry grass, right? Now you're in bad shape. That's where we were when this started. We were actually there before we even knew we were there. This is now the insight that the disease came from Europe to New York because it was already out of China by the time we realized it. It went to Europe, went to Italy, went to the Lombardy district, got on a plane, came to New York, and it was here much earlier than we knew. And it was spreading much earlier than we knew at a much higher rate. We have to be down to the one person infects one other person. You can't really go beyond that margin. Right now, we're at 0.8. One person infects 0.8% of a person. So one person is infecting less than one person. That is good news. At that rate, you see the virus declining. Upstate, interestingly, it's 0.9. Again, statistically very close. But upstate, the infection rate is one person infects 0.9%. Downstate, one person is infecting 0.75. Okay? So that's where we are across the state. If we keep the infection rate below one person infecting one person, that is where the infection rate continues to drop. That's where you'll see the curve dropping. So we have to stay there. How do you monitor it? You have 3 basic dials. Number of hospitalizations, which you see every day, which I show you every day, the number of hospitalizations. And you can see that by region. The number of positive antibody tests. This is why testing is so important. We're doing antibody testing around the state in regions. Antibody testing tells you how many people have been infected. A little bit of a lag because you only have the antibodies after you've had the virus, but it tells you on a lag basis how many people have been infected. The third dial is the diagnostic tests, which are just positive and negative. And they tell you on an absolute basis what your infection rate is. Those are the 3 dials that you're watching. You take these activities, you watch those 3 dials. And you have your hand on the valve, right? The activity valve. So you open the valve a little bit. Phase 1, watch those dials like a hawk, and then you adjust. That's called the RT factor, rate of transmission factor. What is the rate of transmission of the virus? We're now at about 0.8. You cannot go above 1.2. 1.2, you see that number go right back up again. And we'll be sitting here talking about showing you a chart that showed up, down, and then up again. That's what happens if the rate of transmission gets to 1.2. So this is the balance that we collectively need to strike. I want to get back to work. I want to get back to work. My kids want out of the house. I need to do something. I understand. We have to do it intelligently, and this is the definition of intelligence in this context.